As we all wake up every day and go about our lives, few of us have to worry about putting ourselves, our family, and our friends at risk. Risk of contracting a deadly virus that could put you or your family in a hospital ICU. Risk of permanent mental and physical health issues. Risk of the exhaustion that comes with the unavoidable chaos of working in healthcare in 2022. Hi, I'm Sydney Ferland, and I spent the semester talking to Concord Hospital healthcare workers about how COVID-19 has affected their lives, and in the process, learning the unexpected reality of day-to-day life inside hospital walls. Only the severest cases of COVID-19 are seen by healthcare workers at the hospital. This means that every day, doctors, nurses, and everyone in between must put themselves at risk to care for patients that have little hope of ever making it out of the hospital. The people that care for these patients have experiences and stories that are unlike anything heard before. This is why I decided to interview and record my conversations with various healthcare workers at Concord Hospital and put together a documentary that shares their personal experiences in hopes of educating those who know little about caring for patients during a pandemic. For my project, I interviewed 7 different people that hold a variety of positions throughout the organization. I spent between 30 minutes and an hour with each interviewee discussing topics such as how their jobs have changed, how their family lives have changed, how the pandemic has affected their mental health, how understaffing has affected their work life, and much more. I was able to speak with Sarah Sherwood, an oncology nurse, Mark DeGracier, a nurse supervisor, Jen Leonard, the nurse educator responsible for the vaccination rollout, Allie Murphy, the manager in environmental services, Jen Fletcher, a nurse educator in the emergency department, Penny Perry, the director of the employee assistance program, and Jody Case, the director of the patient value stream, who also oversees all inpatient units and works as a nurse when needed. After completing my interviews, I used iMovie to cut, edit, and attach over 90 minutes worth of footage together to create my documentary as a display of all the work I've done educating myself, family, and friends about the unseen struggles of healthcare workers today. I found that in talking with my interviewees, it gave them the opportunity to feel heard and showed them that people appreciate and care for all the hard work they do. My documentary will be posted publicly on YouTube for anyone to watch and can be found on my YouTube account by searching my name, Sydney Ferland, in the search bar. My project also included community outreach activities with the intent of supporting Concord Hospital staff. At the beginning of the semester, I spent time making cards to hang in the units of the hospital with words of encouragement and appreciation. I was fortunate in having help from friends, family, and my health science class in making these thank you cards. More recently, I was able to set up a holiday gift card drive that gave community members the opportunity to purchase and drop off restaurant gift cards in a collection box. The gift cards were then donated to the hospital for distribution to the unit managers. This gives managers the chance to order food for their teams so staff can have meals when the cafeteria is closed. Through this drive, I was able to collect over $350 in gift cards to Panera Bread and Constantly Pizza. Lastly, I want to discuss how this hands-on project connected to the research I conducted as part of my senior seminar course. I researched statistics surrounding COVID and healthcare, more specifically how the term burnout has developed an entirely new meaning over the past 2 years. I was able to visualize the connection between what I'd researched about exhaustion, stress, mental health, and understaffing as it's displayed in a real healthcare setting at Concord Hospital. It became a very prevalent part of my project because it gave me the ability to connect with my interviewees and relate stories being told to quantitative data observed in my research. This project taught me so much about being appreciative that myself and those I care about are healthy and have access to vaccines. There are people in our community that battle this deadly disease every day with risk of contracting it themselves or bringing it home to loved ones. Not to mention the emotional pain they endure watching patients die and knowing they don't have enough time in their day to give the quality of care they were able to give before the pandemic. Knowing I want a career in the healthcare field was always a driving factor for me throughout this project, and it gave me the unique opportunity to deeply explore the field and talk with people that could teach me about their lives at the hospital. I want to give a special thank you to my mom, Valerie Ferlin, the Director of Employee Wellness at Concord Hospital. She helped me get in contact with all the interviewees and came to every interview with me to learn about the experiences of her fellow employees. She also made it possible for me to walk the units with her and hand out appreciation cards while personally thanking our local healthcare providers. Thank you, Mom, and thank you all for taking the time to hear about the work I've done this past semester.